Some oh yeah man, we have to there, you know. I feel there. I want chill. Alright, me have two other things to deal with, but me have to deal with a COVID thing and the hospitalization and them thing the same. Can me just say something just drop out in a toilet paper. The 29th August. With a record, I have 929 new COVID cases in Jamaica. You know? And and the people them have to feel it now for the no movements there. Well, and of them that keep the dream weekend around 2 party every day for around 1 week. Around 10 party keep big party. I'm not talking about party them that big show. Thousands of people. All kind of people mix up down the police, everybody. You see them a playing a water, you see them a do everything. DJ no mask, nothing. Nothing no follow, and then you so much people are get knocked down. That's all. See? So me say a thing like this. I want to come talk out, you know, because you know, we don't talk about them things. But what puzzle me? What really puzzle me right now? What really puzzle me? What puzzle me personally? You know, the hospital, you know, the health ministry. I said we don't have no bed space. You know, like a COVID people, them take it up completely and no one them thing. So we don't have no bed space and you know, they might make it sound urgent. But let me tell you this, you say if you not plan long time and the amount of money you get from overseas and them thing there, when they don't feel hospital, stop on the foolishness. You if when you hear them attack, and I like them got 3,000 in a hospital, so them now on the bed are 5,000. Them under 8,000, like 700 people. Bed space. That's how them put in or whatever with them get 700 people, right? And them run out of bed space. We have 14 parishes. You know, Kingston St. Andrew are one. So we get realistic now. Or you run out of bed space. And them might make it sound. Yeah man, because I told them a year and not turn on the yard. The people them were there them yard now were hungry and them thing. Them never their gym weekend. And them did go and spread it and them thing. They just look money. Blessed and brown. Up. See? And the things spread and all kind of things. And then when they come on the talk, when I talk, I will look on some statistics, and then we attack, you know. Because we like keep things for the level, you know. So this is how I see them fling out. And the detour me from when I attack, for just come talk about that. So this is how them fling out. And them are tell me the cases now. See? These are the cases in a 24 hours. How much people perish. And then look on the parishes. What go on, man? Yeah, man. But the government, them no want, not at all. You know, when they make some money and then poor people are pressure. Some people never even leave them garrison yet. Never leave it yet. I'm going maybe go down town, go have baby and come back. Never leave it yet. Never go Westmoreland and Niguel and nowhere yet. You see me, I say, Nadine, big up yourself. So, this is how them are show away. But me could dissect these people because, you know, we have to talk to them, you know, because them want some people who just come and talk some foolishness. We know that with them. But all the bed space go, right? Because we have so much hospital. How much hospital we have? We can go look for how much hospital we have, right? And right away, them I mention about bed space. Let me just go into this. Into this. So much people, them say hospitalize. Me I watch this. And anything under 8,000, I go hospitalize. Hospitalize. So anyway, it's somewhere like 700 and something. Yeah? Hospitalized. So it's like 700 and add, right? And 1,000, right? Okay. So me I watch something and I watch them thing. See there? Health and way. When you see what me depend? Yes. So me I watch how much hospitalized, 27, 29. So anytime you see them say hospitalized and who get better, you always are like 700 and add somewhere around there. So you know reach 1,000 yet or nothing, right? Alright. So make we ask them a question now. Make we ask the government a question now. So I think I come in from 2000, right? From 2000. We know about it. People talk about field hospital. And we saw that go. Right? We have the hospital and before COVID. People never did get no bed. Alright. Them say them carrying few. We have 14 parishes. Kingston and St. Andrew double up. Alright. So we never use National Arena and turn it into a field hospital. We can't have cover and everything and thing and we just get some bed and put in it and them thing there. Even if it's a 500 bed unit, you know, upstairs and thing and just free up COVID. So I free up some hospitals, free up university, free up public hospital and free up some of the hospital, but we know it's alright. Yes, so them get tested, yes, so we treat them. Why we never do that? We don't see why we not do it. But check something like this now. So every parish, how much bed in every parish? But some place are 11 bed, you know. Them are free for COVID, you know, and some have 33. Yes, still Westmoreland and Lone are Hanover alone. I remember that big thing hit on there and Mobile. Yes, so much of them are run out in this thing. And people come from all Kingston and I think they don't mix up. Yes, so much thing there. How much bed we put together? Since you don't have no planning for year and add now. We don't make them at the same bed. So now we run home some people and then when you use it and say, we run out of bed. We never have the bed before. People up on the floor. I say there's some other things with people up on the floor and all kind of things. Remember people sick with diabetes and everything and stand up, you know. You understand? Government, we don't do better than this. I'm not talking about people and about this and and bed and run up and down and no, we don't have no oxygen neither. That means we never make a plan. Can you have one pan island and that send somebody from Ministry of Health, either send and either assess what we have and the input. Okay? And you say you get some from maybe Guyana now from Trinidad, that where you get it from. You're buying some then. So you kind of tank them stay, them back there. So you store up some. I don't joke me I make. And the bed, nobody talk about the bed. So I could check it by parish to parish. If we put 50 bed, and then if we not say COVID and more than that sick in our parish now, right? And if we not put even 100 bed in our parish, I feel office with 100 bed. Even if it's a camp outside, in the hospital ground with 100 bed, you'll get 1,400 bed. Them won't overflow now, we have 700 and something people who not admit. I want to tell you, we want to burst to see man run up and down. We don't do nothing like that, man. You know why you for money, because we don't do nothing. We get money from overseas too, you know. We discover things with the money there. We could have done a lot of things, we could have done enough more. We don't make people suffer who dead. You understand? And what for there, what for does come talk the truth, you know. You see me I say? Yeah, man. No, man. Even you say people have to be responsible, we can't blame much government. What you say, man? What you say to me? What you say? People have to be responsible. You can't blame the government. You really live in the world, man. We not play that game there. We not play that game there when it comes to Jamaica. But other rest in the world, people blame them government for what them not do. Remember, you know, you mean you can't blame government? Let me tell you something why you're wrong. The people them there Jamaica, COVID no come from Jamaica, man. Who open up the border, you have to blame. Them couldn't open up the border. That's the first thing. Just look for yourself and me I tell you say you're wrong. So me if you want who this say this. Yeah? Yeah. So carry on. If you say them can't blame the government, them now not choice because the government open up back and say, listen me, the tourism have to run and this have to run. I mean you can't blame the government. Most of them have never passport. So anything come from you and like you want it come from you in your village and town and them bring it from you. What you talk say? When the border they shut, only say yes, everything nice with the government. But no, you can't blame the government. You can't have it two way. Yeah, ma'am? You understand? Them not travel. Most of them where you see, I run up and down and I get locked down, them not travel. Them they not food feet. Them not leave them place. Me know people are East Kingston over time them go downtown. If some woman just have them baby them go do the liquor shop now come back. And them not go nowhere. Them not go no country to country. But you say you can't blame government? That means we don't need a government then. If you say you can't blame government, we have to get rid of them. We don't need them. Make the place run like how the West was one. Because them now look out for your well-being. So you can't have it two way, you know. What you do? If you say them people don't need government, what you do is fling the government under the bus. So we don't need them. Because remember, the people them can't make the decision to open up the border and close it. So you don't say you're completely right. You shouldn't even say that. You should just wipe it out. You understand? Can't reason with me, you know. But we can't reason. But you want to reason that way there. You have to blame government. And with them take because them say, oh, you have to work with this and that. And then them make the win. Remember them look at poor people and our dream weekend and not like that, you know. See? Are the same government and them friend and all kind of little thing. Where you say no blame government? Don't be, listen. You have some people who know say it hurt when, you know, depends if you love a party and you see and you just say, alright, let me just talk for the party, but talk with sense. You understand? Talk with sense. This is not time for love party. We are talking about people life now. We don't want to put people life. You understand? So you can't say, I'm a matter of fact, you can't say masses of poor people. Government sit down and get a bag of things from overseas. But we know. Can we check on it? Okay? We see one what them collect. How much time you see them go out and say people stay in your yard because me I go now, this and that, and I provide the food for them to stay for the 3 days. You have people hand them out. Anybody say that them wicked to the people, to the real poor people them. Can you know say you have people who maybe in your family they can't even find today's dinner and them can't come out tomorrow, now the next day till Wednesday. That's what you say, man. The whole of them decision here, if people can't blame government, them that feel for just come out and go on where them are going, man. And go do what them are do, man. You understand? Mo no work in the border, mo not do what them are do. No, that's how we say we can't depend on tourism alone. So government do all these kind of things. If the people them alone they shut the border, and they say, okay, we could just import the food we go and run this and we could do that and we go and export or we export. But we don't slack off the thing and we no business until the place restart. You don't do that. You have to blame government, you don't have to talk over that. You understand? You have to blame government, what you say? Say, I feed them choice that. Let me tell you thing, and you can't, when something now go good, you want to feed nice here, and you have the choice of me, the depth of the choice. You can, what me I do, tourism, alright, let me tell you, by the way, I do little tax, me not bait up my people, make them dead off for una on the tourist money. Una for gosh, go away. Una make all the ship, them are coming back and they say it's free, you still, corona, the virus on the ship. The other day when they come. And more will come. Them don't believe now people, them not busy about the people. And then people they make decision. See, let me tell you this. Even the money about the value here, some people say, but people them this and that, are the big man them. And the same politician them. Because poor people, you can't even buy food much as you buy the money. Where you buy the money for? And you don't even have a bank account. You don't have the money. So I do the country like this. Everything need to them. Then them say no, them little guy in a paper the other day and talk some crap. I talk crap. Like him forgot to the place shut down till June. But the Prime Minister come and say we could ease up little this and that because the during weekend and some other people have to go get you with them little thing and you know business. You see people can't play who from foreign and the bag of tourism and tourists and then police and everybody mix up because you want a little dollar. And then when it don't know it, look on the place. When you have the hotel I run, it have to have workers. And the workers, them are work hand to mouth. Because them, for them talk to me. Them are work hand to mouth. And when they work hand to mouth, saying, them still have to go to work. That's how when them go to work, they carry it back into them place. The environment is easy for spread. So when I mean you can't blame government. Everything will go on a government. A government, man. See? I want to stop that thing. They want to say people can't blame government. Remember, you know, you as an individual, you can go out there and say, okay, me not go pay this, I me not pay no tax on the food when I buy, I me not pay no tax. And you have some people, set of people always say, poor people not pay tax, stop that foolishness there. You spend the most money on they rob the most as poor people, man. See? So you might buy from a corner shop, but corner shop buy from a shop, what charge him the GCT. And then him not even charge you back next to GCT. If you say about me recover this. In charge you and put even your PR 40% on it because they have to send film thing so you suffer the most. But the things when I buy it never come with GCT and everything from it come with it, I pay it. Them just push it now the thing and you still pay. You go for medication, you put on them put it on it, you pay a light bill it on it. See? Water it on it. See? Them pass it on it. When a man do some woman charge a bus here. They might tell us a GCT and everything because it pass and the gas, so them write up that them can survive off it. Everything pass back by your man. You understand? So when the total gas, you full of tank, and say you full of tank for, alright, say you full of tank for your bills then. And you say, okay, but full my tank for the bills, it can hold me, make how much trip. Say you can make 4 trips. And you say, me can make 4 trips, depends on where you come from and you're full of tank. You spend on bills. You know, you have to charge the people them according to if you charge them say, boy, at $10 this for go this or at $10 because you want to make back the bills plus the profit. You make back the gas money plus a money for yourself or plus a money for who you drive. So when you don't know, you want to know, so when you full back your tank, you have even 2 bills. So you can give the owner fee bills when you get and you have a bills in your pocket. That's how it going on. You understand? But who feel it? The rich man them have vehicle and thing, them not take a taxi and them thing that the poor man feel it. Everything tumble down on the poor man. I want you always remember this. And always remember this, even if you move with a party, remember say you have cousin and mother and brother and sister well maybe now move with no party. And no business about no party, them born government. You understand? And the kind of movement and the kind of things for them take and for granted and with them push. You can't have third world country, but government live like first world government in a third world country. And then frontline worker now really get paid for them jobs. So you find out, say if you're sick and going to them places, you're going to suffer. And if your body not strong, I just you that. Because them not beat up themselves for you. Them a take out everything the government will pan them, pan you. As a poor man. Always remember that. You understand? And stop talking about government. Them can't people this and that and them can't blame government. They no government open up the whole place. Them shut it down. You try go lock it. Just try lock down one word and so much police rush you. Just go and go block it. You want to block it, just go block it. As much as you go block the airport. Or you shut it down. Eh? Our government do it, it affect your life. Then you need a government then. So if you stop say that thing there, nobody only must blame government and the people them stubborn. Stubborn with what? Eh? Stop that foolishness, man. See? And then I not expect people who travel and live overseas to talk them foolishness there because them have for them kind of freedom when nobody na tramp upon them rights and thing and then you have to lay it down same way. The world intertwined. Government Jamaica are unique. We want to know if the ministry did prepare and I feel and put on some field hospital. 700 bed and then you over this and burst to the seam and run up and down. You never prepare 3,000 bed. Not even 3. We not reach that yet. Because most people want to say sick, them they home and everything. But to the 700 hard. But the bed them done. So if you have 100 for each parish, 100, even a field hospital with 100 bed, you'd have 600 beds still empty. Because you'd have 1,400 beds. You understand? So Kingston and St. Andrew, you say, all right, 200 bed field office. And then there's about 100 bed. See? And you make the field office out there, so that means them now have to go in there, so go mix up with the one bar, so all right, I could do this test them, we have them over here, and we don't do it, we don't have enough time to prepare it. See? Wait there. The first when we just have the first COVID them come out, we are going to answer, bless up Yankee, bless up everybody, the first when COVID does come out, them run and them lock down this and them do everything and boom bam and them say, yes, Andrew are the greatest because boom bam bam. And no, when them say, yo, let go this and let go upon the people them. Zoom. Yeah, but people don't care blame government, the people them too stubborn with what? You can't have it two way. The people them by themselves can't go and shut down the airport and say, yo, we don't want the tourists in here and nobody not flying and just check right and them thing there. Eh? Them couldn't come and say, yo, boom bam bam and dream weekend, them say it's a super spreader. Super spreader. And everybody just quiet so. Them have cafe already and them seat already, family. And now it come back now, you say a super spreader and nobody, them don't want to talk because when you talk now, it make government look bad. Then I said, go, people are dead. See? Can't go talk about government look bad, man. Yeah, and people now have nothing at all. People can't eat food and people get locked down. People now response to dream weekend and response to where them are going with. Them just want to live them normal life. And them are get locked down right now. And you have enough people. Starvation and kill more people. I end them up in a hospital more than anything else. Because them not have nothing to eat. When we say nothing. You understand? Yeah, man. They don't have nothing to eat. Yeah, man. We cafe them was a super spreader to man. Them was one to man. And then you add fuel to fire. You come now and have dream weekend 2 of them big super session. You want to look at me, I look at one or two them, man. When you look at crowd, man. Everywhere in the water, no mask, nothing. Police at gate and everybody and them nice. Because you just say, we could just earn the dollars. But lose the life. Me rather save the life. And the dollars can't stay, we can make it back the next day. You understand? And then the diaspora, them don't have chip in and they just say, yo, the diaspora, thank God for the 3 billion because the chip in and take for the tourist thing. So diaspora, every day, diaspora sending money and do something. It's satisfied more now, but when they can't gamble the people them lives on in a cocoon now, bro. You understand? You know, when seal off, it's a sin. You see me I say? Yeah, no, but them no mind, you know. Them no mind when them just say, can you remember, you know, as I said before, enough of them hotel owners, the one they were foreign own them, foreigners own them, right? Them the money don't come to Jamaica. You're there in a place, you just book and it stay there, so. Me just have somebody can just text me and tell me, oh, them get paid. I work being in one of them places. I say, listen, my thing when it make up, my time make up, you see where the money I come from. Whether from Mexico, and you have some I come from in a Europe, them send and transfer the money in your account. Them they even pay it from Jamaica there, so. From a Jamaica bank. I say, what? Them send it to me, man. I see it, man. You understand? Me see it. But me I said to the ministry of health now, when you want to push out this, I don't got to talk about no bed. Me I say, the same money market me, you couldn't buy some bed. You couldn't, the diaspora that help, you know. You know, people could have come and say boom, 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 and then we make some field hospital. And then we know, say, well, we have some field hospital, I better when I use it more than when it did for use. Because why would I put the field hospital in? Because we say this is not done. And then you have accident going and you have people that have baby there, so you have this, you have that. So we just have free up the hospital and we have field hospital near there. And then we set out that. I better we set it out and not use it. No, nothing never said. So right now you have people are complaining about in the hospital, one bathroom you see everybody who have COVID or who not have COVID, who have this respiratory problem, no, a nurse dead. I already want to see it in the paper. No oxygen. We know these things. You know, number one, you have somebody from Ministry of Health and Wellness. I will check and say, I wonder if the capacity una can afford to give the whole of them thing with IGL, una alone can do this. All right. We have to import some of them and put it on like it and done, you know. It come in a back like gas. It's a gas. It's in the oxygen. Come in. Same way. See? See, that's why we import some of this, we get some of this that mean we know so we have a month supply. You know, if we have, can we have a plan for like 5,000 people, 700 people in a hospital? And you have to be a boss to see me and I went up and down and I chat one bag of shit. So if we have all, so remember when I said maybe the whole we get it. And we have 3 million people. So if you have 10,000 people for hospitalized, that means the whole place a collapse. 10,000. It a collapse. So if you collapse at 700, we not talk 800 people, not 1,000 yet. We're in a hospital through this thing. Because most people them talk about them yard and what have you. See? If you plan for this and you never plan for 10 to even 10,000. Just say make a plan for 10,000. So if you have a big thing. Yeah, that's 10,000. See? So you have to make a plan for a certain amount of the population then. See? 10,000. That's 10,000. See? And if you make a plan, how much percent of the population that? 3 million. You see me I say? If you have a million and you have 10,000, you say, you have a million and 10,000, how much percent of the population is? Because 10% it'll be, yes, too much percent? 10% of a million, it'll be 100,000. I mean, I think you have a million. See? So so you go back to 1%. If I less than 1%. Just plan for 10,000 no? 10% of a million. It's 100,000, don't it? You see it? So if you say you plan for even a million, and you say you just plan for even 10,000, what percent that? You didn't plan for that. You know what I'm saying? Remember plan for 1% of the population, and not even 1% you plan for. See? You know even plan for 1%. Plan for 1% and say, I plan for 1%. See? You see me I say? Not even that. And then you have just 700 and then it bust by the seam and then, you know, no oxygen and everybody just get oxygen neither, you know, but no oxygen and this and bus and staying on the yard and no movement there will not solve this. And I'm gonna listen to an advisor because that's stupid. Alright, so if you're doing no movement there, enough time to tell that down back the border and make the thing stop spread and stop coming in. To clean up the place. Because the border and lock and everybody still at work and still go back in a era. That means what I do is spread it more. And when you have your Dakota from Saturday, evening, the whole of Sunday, the whole of Monday, the whole of Tuesday till Wednesday. People will bungle up so. I will come out for Wednesday, Thursday, Friday, look up at Saturday. Then you have more chaos and more bungle. So that mean herd immunity. That mean you spread it more because more people, the more days you have, figure out without panic, then you have less people bungle up. So when you bungle and take out the days like this, and you do this, me I tell you say when I do it costs more harm than good. I mean why you wanna who wanna say because only two ways you can do this. If you can do shut down, you have to shut it down. And if you say me I shut down for a month, but all the people them are gonna eat. And move. All the people them are gonna eat and survive and them thing there. So either you do one thing or do the other one, then agree. You understand that? You understand what I say? There is no way. There is no way. There is no way. The shot when you lock down people from Saturday evening till Wednesday morning, and you come out now, you have a bigger rush, you have a bigger set of people to deal with, and them are gonna pile up more. So all it I do is like, it's like alright, like you lock up, you have a Cuba, you have all of them chicken here, and you have them in our place, and instead you feed them one, you have to feed them every day. I have some agro go and greedy. And anything. If you say that you have to feed them every day, you lock them off, and some of them never eat or nothing. And then you just let go everybody one time. What you think will happen? A stampede, brother, man. You don't know them things, man. Then that mathematics thing for the work up. Them that just reality. That's just reality. So you spread it more than anything else. And then as I said before, you have some people who go, them go think about party and all kind of things, and them dead and them just Prime Minister come with this, so it's right. I pay dumb things him do. You understand? And you have to point it out. I remember, this is not about you as a PMP or you as a GMP. This is about a government. And a government for everybody who no vote. You understand? How burn out government for them foolish action. You see? Yeah, man. You see me I say? Because tell me what now. No care what happen, everything are going in the coffers. And him must spend it. And them must spend it. See? And every mistake them make it hurt you or hurt your set of people them. And you have to point them out to them. And the media houses will have to point it out to them have them in them pockets. So them know this and them not do it. So them say somebody have a planning institute. One of them guys there, I will come tell me, say April to June. Remember, April and May, the place stay shut down, And June now, when the Prime Minister come and say, make we ease up some restriction, he come and say April, then June, it go 12.9% at the fastest in a war. Him forget fired right away. Because they make millions of dollars to nothing at all. I don't know where I run to the paper, but you think people eat that a fool. Eh? Yeah, so much people, if you look at the paper every day, all they say otherwise than that. People hungry, chicken back raise, price gone up, people can't pay a bill, people are beg for bill this, people are beg this and that, and you come with a bag of foolishness. And what happened to you now? You forget fired. You understand? And that agency will shut down. Government as a small country have too much agency where we have pay too much money. With some little idiot man will come talk foolishness and people run with it. You have to tell them the truth, man, and burn them, man. You understand? But as I said before, we want to see the government now get active and put up some use arena for one. Make some field hospital, put out some field hospital arena. And you can have school in some other place where it lock right now when I open, face to face. Use one of them or something. And you must have some centers, something the centers use. Turn it, no, because you can't take with the center neither, because you have some people that the center them use. Get up something big there, use a field hospital. You understand? Set up some field hospital, even find some of them grounds there. Set up even 100 bed each. Be not even tell them 200, I better you set them and we not use them more than we want them and we not have them. You see? But nobody come and tell me about bed overflow and cold bed. We never have bed in the first place. Some people when you come with 30 at bed, some people have 20 bed. Them their bed, man. You could have pandemic and say you set up bed and you come with 20 bed and 11 bed in some place and some other, and I talk about bed. And then I tell you about oxygen and our government. And then you have some children now when you talk, bust up the bed, them depend blah 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 blah. You have 10,000 bed right across the island. Even 10,000. Because if you say one did say come show it, say, you know, one said the world away have this, I must if you're afraid and what for work, will you tell me that as a Prime Minister? See it? Not me, you say it. You understand? So you said the made of them that hold you accountable, like how we hold you accountable and draw back for your things them when you talk. Eh? You know, say you're full of F. You understand? You're full of BS, man. You understand? Yeah, man. Full of FBS. You see me I say? Yeah, man. Because the be foolishness are going. So you can't come and tell me, you know, say, you know, you have this. And then you fight the people them and then we don't have no, and I tell you what we don't have. Go buy it. Sources. Sort it. You understand? Should have been in the country a long time. Should have said, well, wait till when it come. So we are sure we are these things now. We want to do dream weekend for. And look on the dead people. Look on the dead today. Look there. Eh? Yeah, man. You see me I say? Look on the dead when them are show you. Eh? Look there. Eh? This don't look good. Yeah, so if you are sure we in the place them too, you know. Alright. See, you are sure we in the place them. And you are sure we the age and which part. See? Now show on certain people in call them name. So now show we how much. So we're going over 1,500 debt them say now, right? Then that's 1,500. See there? More than our gunshot and them thing, you know. So the debt them go up rapid 21 one day. We not pass them thing there, you know. So we are one day to just leave the people them for us, you know. You understand? People are move. See? Yeah? And then you know why nobody for talk. Eh? A people life that, man. See? A people life that. We all come and talk and we are fight it out. But we said the government should have even a 10,000 bed and not even one. Even if we make some, even 10,000 bed field hospital. 10,000 bed. We see it up in another country. They have field hospital all over. We want to never follow that. Why pan that for follow? Eh? Should have some field hospital. I mean, I thought not more than every parish just give a 200 bed field hospital. Even if we come and say 100 bed. Because when we make the count now, it will show you say this amount of people they have for this amount. Them not, and them tell you how much hospitalized. Them say 700 and odd. So which part the most of them the bulk they that's how put a field hospital letter. Me know so and you know reach 200 or something. So why not do that? Why not do that? And then the people them will come up and talk, say, you know, I know government can't blame government. We need to stop the foolishness there. Yeah, a man can't come out, come black the road and go stop and run on the airline out there and say, hey, remember stop playing and things. Government make these decisions for the citizens of Jamaica. I ever put the citizen first. You understand? Put them well-being first. You know, number one, you don't even make the shop them. Do like overseas. Every one of them shop there, them have to stand for some responsibility. You understand? Them have to stand up for some. You see me I say? Yeah man, EU and Canada and US to give them money. Them the one of them get money. Get enough money, man. Can we see the money, you know? And UK too. Yeah man. The one of them can get money from the one of them and then them get free medication and free thing. Get too much money and how much equipment the other day from even India. Where I go through separation, so them get it. But me I say from last year June, the people them get a little $10,000. And I know, and then the police them take it and start lock you up and take even more than that. One man up here 60 grand and all more than that. See? You understand? And then you have some people who are, they like, when them do them scout outline and them send them out, you know, so troll and let them come and them talk foolishness. Stop talk foolishness. For people cry say, and don't bother come with, one thing with me, you know, means not a yes man, but only can come talk to me and say, okay. And the people them now here. Like some kid do not talk to like one. The people them there in them place, some of them they even travel up on plane. Them not leave them place unless they not be able to tell. Some people live in some district, them you have people live up in Papini or go up so. Them don't know downtown. Never come down there. Can you go university hospital and have them baby and thing and stupid and with them there. You have some people at East Kingston, them don't know west. And some people at west don't go east. Never go St. Thomas. I saw it going on enough for the places. See? And them never go down the country yet. But you have Dream Weekend now and them thing there and people and money and tourists and mix and then you work there so if anything and a man have something spread it and then you carry it back in your place. And you might have go visit a family member you never know so them get it and then they carry it. So it's a way they must spread it. The government they lock down the place. But look on this. You have woman that are sick and must lose her baby. They on a ship and then let them in. None of them. That are not dead, they are just one somebody and everybody say, yes, good work. I know we don't want to come talk about the people them now you stop on the crap. Keep it tight away that make we keep safe then. Like we not keep it. But go chat today, the people them who have the hotel, we should not we are most the foreign people and them thing they make sure when them for them people come out, government hear them. Government listen to them because them know so them not play. So government listen to what the people them attack. So you know, try to hold them up and do what you want to do as you like. You make sure you talk to them and say, okay, we have to work together. We can do this and for your time and we're going to do this. You come with a bully and tactic and them thing there. Now go work. People are come out and go on bad. You see? And at that them I run from. Me and Motley as a leader. Boy, I have a player, A woman them have a player because she feel like a small country, 166 square mile. I play me a monthly. I talk about one. You don't man get it here. You look on this now. I try to show you leaders. See? Look on leaders. Hear this. Hear this. Hear this. Me have a player, because this is a Barbados. Player alone, some player.
Because everybody else has spoken, the private sector has spoken, the unions have spoken, and we will meet again on the 30th of August to have further discussions as one. But I feel that it is important that I now speak to you about the government's position, the cabinet's position. Philosophically, I personally, and most of my cabinet, in fact my cabinet, have all agreed that we should not mandate vaccines. We're philosophically opposed to the mandating of vaccines. And that's not who we are as a people. Barbados' overriding objective must be to, one, yes, to keep this country safe, but equally to keep this country united. That is who we are. 166 square miles cannot admit of the serious divisions. And COVID has done enough damage already. It has threatened too many of us. It has taken, regrettably, those 48 persons. But COVID must not be allowed to divide us as a people or as a nation. And that is the commitment I give you as Prime Minister of this country. To that extent, therefore, we must dig deep and understand who we are. What is our DNA? What makes Bajans tick? And more often than not, Bajans operate on the basis first of respect. You got to see me, you got to hear me, you got to talk with me. Mm-hmm. And to that extent, that is what we feel that we need to do as a nation. As a result, yesterday when the social partnership met, we all agreed that this is the way for us to go, that we have to do better by our people, and that before we start talking about legal opinion and the legislative framework, those things are not us. And that our first thing next week is for me to go to understand those who may still be ambivalent, those who have already made up their mind. I get you, I hear you, because in my own family I got people who believe in alternative medicine. I got people who say they don't want that. But in every household there are always divisions that are possible. There are some households where people are vegan and the other person eat enough pigtail, enough pork. That happens. We know it only too well. There are some households where you have one buddy who is a devout Catholic, another one a devout Pentecostal, another one a Rasta, and another one who says, boy, I really ain't sure who I believe in. Agnostic. That happens, but the family is still one. And these are the things that we need to recognize, that we have never allowed these things to divide us as a people. And whether we support vaccinations or we don't support vaccinations must not be allowed to divide us. COVID has affected 2% of Barbadians in terms of people catching it. In terms of the well-being, mental, physical, and financial, it has affected 98%, if not 100% of Barbadians. But what it must not be allowed to do is to divide us. And to that extent, my friends, we now have to work together as a people. I believe that there are certain institutions where we have to equally be conscious, however, that we do need to encourage a healthy uptake, largely because of the evidence that I presented to you earlier from countries like Iceland and other countries where the clear high percentage of vaccinated persons has led to either an elimination or a reduction in deaths and a certain reduction in hospitalizations. What does that mean? That, for example, persons who are not wanting vaccines because they're a little ambivalent, we can come and talk with you. Persons who may have concerns or medical questions, we can try to find the answers for you. Persons who are adamant that they don't want it, we respect you. But we want to recognize also, for all of us, that this is a country where we invariably never have 100% of one thing or another, but we have learned how to live together and how to carry each other. Barbados is the country that ensures that we make sure that all our children are educated, even if they don't have access to the money.
Even if they don't have access to the money. I shall talk about the L2. This is what me I talk about. Here, listen.
The country that makes sure that our people have access to health care, even if they don't have the money. So that we are accustomed carrying each other. And in this battle, we will have to respect those who have a fervent and deep philosophical perspective, or who for medical reasons genuinely cannot take the vaccine. And for those of you who are ambivalent, I can be straight. I come in to help persuade you, because I believe that vaccines will save your lives. And to that extent, the questions that you may ask, how so fast, what we're doing, all those things we want to talk about. But in certain particular scenarios, it is even more critical. And what do I mean? You have a right to ensure that in our healthcare facilities, people are protected. I believe that the doctors live by the motto, do no harm. And to that extent, I want to go myself, starting Monday afternoon, to the healthcare institutions in our country. I'm happy that our public health nurses, I'm told that the level of vaccinations is just under 80%. In other words, 8 out of every 10 public health nurses are vaccinated. But we do have some issues still in our hospitals that require us to move the numbers up some more. I want to come and hear you directly. And I pledge to do that almost every day next week across the different institutions. Because
so that more want hear. No, you will see that's a Barbados Prime Minister, right? And instead of you have a Prime Minister come sit down come talk that, me just show a program where Prime Minister tell us, well, the rich man them more, you know, them have the knowledge, but poor man them true them not have the knowledge, and them no, you know, them not have access to certain things, them dumb, them stupid. And that him saying in speech. Sometimes make some speech it hurt me till me I wonder where my talk say? Where my talk say? You talk something that is disrespectful. Yeah, she respect you. So she say, if you don't want to take care of that, if I get you, I understand reason with the people them. But when you lock them down like this, and then by Wednesday them come out, what them are gonna do? Some people never eat it or nothing. We just see in a last week paper, or some of them in a I think out a 3 mile lesson. We don't just a name back to somewhere around there. So. I said them now have no water. Because when they use them tied it, remember them live on some building and them thing. They use them now have nothing for flush. 3 days, no water, nothing. And them have to break the curfew thing and them have to come out and look water because them tied it. Now, if you live in a house and 5 hours, we're not using the tied it every day. And then people are poor and peeing at that. Remember, you know, and like, you live in some bush where you have some people that run going on and go dig a little hole and go on with them little thing like them their country, or get some newspaper or some bag and wheel that. Or you do that. Eh? And then you have the water for wash your hand, but you still will say, oh, okay, the pandemic arrears, but on no business about nobody, just the police them out for beat up who want. It don't make no sense. I mean, I tell you, when you cut off the days, but you should have cut off instead of cut off the days, cut off the same stuff people them want come in now and say no because the virus tell them I want to reach from in June. Come when them come make the speech because them have the sample early July, where them talk about in a July, because 14 days. So when them come say, okay, we're gonna lift this in a June. Them know say the thing there from in a June. Yesterday them are going like in August, yeah. Them just find out. Them get back the sample and know. So them dishonest all the time. See? Them dishonest. And then the media not hold them accountable for nothing at all. Them press big up yourself. See? Them not hold them accountable for nothing at all. And then you have some people now where, you know, oh, why is it people when them don't have nothing to eat and them in a them little district or in a them little garrison area, what we call garrison, them little community, and them know I feel the most blunt. When man don't line in pocket and go enjoy themselves and then everything come down upon them. Them not have no food, you know. Hand to mouth, you know. You understand? Hand to mouth. Remember say them not get up like them have 2 days worth of money worth of food. If them find a little money for buy a pound of chicken back and chop it up fine. I'll eat all chicken fat and all kind of things and with little flour and thing and them have picnic for feed. Who business with them? You hear them come out to that package, the next package and say no, what I have to reach them and them have to eat food and thing. No. Them just exempt themselves. You understand what I tell you? Say, you can't have people legislator exempt on yourself. That a joke. That to show us a danmanship when I play a dictator role. Saying, you should have people, but I serious note. No, everybody who agree with me, but I serious note. If Jamaica know this from last year, from January, them know say okay, from it a come and them a say them a plan and what have you. You know things say them that prepare for even have some field office, even if you put them out there, that even have it and set it up. You know, so me have the bed, them have this, me can draw them, the tent, them do this, and have even 100 bed. Even you know, say okay, but have arena. And we have the big, we have them hospital, we don't want no, we put everybody in an arena. Even if it's a 500 bed, up there so. And we can transport other people. 500 out of 700 and add. If arena could have hold 500, it can hold 500 bed. Me make that in a field office then. You understand? Get something and transport them and deal with them as a field office. And then the rest have some even a 50-50 bed in every other parish. It will ease off the burden. After the general hospital completely. Eh? You talk about no bed like with that bed. We never have no bed before. We never have no bed. And like people that like when they get 2,000 people with COVID in the hospital, 700 and yet. And you don't have no bed. And then you question that. These are the things that them not like with me, you know, because these are the things that we dat up and cross up. And I show you say, hey, them not care for the people them. Because they never have bed. You have people dead already and get heart attack and all kind of thing and they don't have nothing to put them, nowhere to put them. And COVID don't stop other people from feeling sick or sick. You understand? High blood pressure, diabetes. Some people now lock up and have the money and remember, you know, they can't go alright. Then the medication will run out. They might have a little son overseas or daughter or somebody will send money for them. Them can't get to collect the money and them thing they say. But and yes, still the medication run out. And them have high blood pressure and them have the diabetes. So two of them knock them all one time now for a rush. Them not have no bed, them not have nothing at all to put the people them. And you pile up some other people who were sick. Some other people when I have COVID. As they hurt you, them put you on one side there so. See? Say that you go sick or you know sick or them not busy about you. It will stop. Yeah? And as I said before, you know when you come out that man like we come out come talk. If the Prime Minister come out come talk like even the Prime Minister yeah, you unite the country. You not do that. You come and style people. You not think about how them hungry. You know, you should say even if you know, probably one thing you must do, you know, you know, divide, we don't make something divide us. Put it together. You understand? If they come when the police them rush out some people, they don't come out come say, yo, listen me don't want to do that. People them you come out after you know, you have freedom of speech and as long as they're not threatening to kill me, I kill nobody, not just me. And say them I kill anybody and thing. You know, free to take out better than blaze out them hang up on them own phone or something. See, him come talk late, but him come say it but him talk late. See? And then most of the time him drop word. Me have a mic. And I too can speak. And some people leading, some people drop too much word. You understand? So you see, when you do now, when you do that, you know, when we are talking, you know, then we're trying to be knuckles by you and say, oh, okay, be knuckles. So you know what, when people expose, you know, like when people expose, you know, when I expose them all, man. You see? And then you control them now, we not even cater for them now because you have some children send out, you know. Yeah, you know, troll patrol. So them kind of children now, we know, you know, build on a thing and want to send one and send, man. We don't want to do the conspiracy theories, you know, and the Prime Minister and the government. The government, Jamaica government is a conspiracy theory government, you know. They come up with all kind of things and tell you you're asleep with the door open and all kind of things. And them have the plan for crime. And if you come and tell people and then we don't see your plan for crime, you can't, I know you don't come up with it. Me not listen to you. I just the truth. If you have something and you say do it, I want to see it. Me are one of them where I hold you to account to where you say. That's just me. You understand? And if everybody stays so now, we couldn't trick the masses. We couldn't trick them. You understand? Couldn't trick them. See? Because the higher look pan the advisor, the Prime Minister, may see Jakuku. To a commissioner and I know them have no plan. I sit down and talk, you ask a good question and get a stupid reply. See? And nobody must talk. Me not work with that. Me a big man, me not have no time. I talk about man, me deal with my grandkids and all kind of thing now and I have my family to deal with and them things. Me not have no time for the foolishness. See? Some of born foolishness. When me see it, me point it out. And this is where the media them should have hold them accountable. You should have the media where them pick one government and pick no care who in a government. You make sure hold them accountable because you work for the people. Them that mean them can work straight. The more the media houses in Jamaica them have them and them back it. You understand? So you know hear them come out come say nothing. They may show you some little youth on this and I show you some of that little thing this and some foolishness. And you know, say, listen me, government and the media should have pushed them and private sector and all of them. Say, listen, make what prepare from now, from last year, you know. Prepare even at 10,000 bed right across the island. It shut up. So when you're ready for use it, you have it for use and you won't get overburdened. Because really, if you get a 10,000 where you admit in the hospital, that means the thing that just got flat, so boom. Every doctor and nurse walk away, 10,000. Cover 700. Me not say 1,000, you know, me not say 2,000. Because if you double this, that means the doctor them couldn't manage it. And the nurse them, they couldn't manage. You see it? Yo. Well, for know where we are going, you know. But you still are spending much money, but we can't manage 700. 700 and odd. See, we can't manage it. Make big fuss. So, man, but what I will tell people, I hear some people, how true them now? Now you with what? When you lock down the place, it make it even worse. So I come up with this idea, I tell you, say, it make it worse, it make no sense. Number one, all them shop there, but you for do as a Prime Minister. If you make people do curve wall pick up, and make people certain place open then, and then people them if you lock down, you know. And some non-essential place should have lock, but you don't do that. See? You don't do that. See? And then you make some curve wall pick up and people can order then and people just drop them off and, you know, drop it out when you reach it, you make a call or something. Who can do that? Do that. And who can do that? So you get less line. You see me I say? And you work with the people them. Every one of them business places have to have hand sanitizer. They have to have mask. They have to have thing when they come in. Everything where people push. Whether trolley in your supermarket, it have to can spray. Have to have people that look about it. You have people that look. People that just step in. So you have people out there. If them are let in 10 at a time, them let out 10 at a time. If it's so bad. Do it like overseas, do it same way, and I joke me I make. Just do it the right way. But the whole of them business place, we have hand sanitizers and everything, and masks and everything. Even the police them go out, so they lock up people and put 20 man in a van, that name herd immunity. Me now ask, so you get bigger numbers than this. See? Like when I say, yo, I could just kill out somebody, because them don't mean nothing. We're not evil. We're not evil. You understand? So, me not too, and then you have two now come out. Well, no blame the Prime Minister, no blame the government, the people them not here, stop on a crap. The people them, and number one, COVID not come from Jamaica. People them look out them own business that uno let in because the money and all kind of things. The people them can't go and shut the bar and do nothing. You understand? That's why them put in a government to look out for them. And if the government not look out for them, that means the government full of bullshit. Saying that people, I don't know why I come out like, sure, nobody must talk about government full of bullshit. And you don't know what I do. And if you tell them the truth, where I do smile and say, yes, give him a tick, what him do? See the place flood and say people and them will lose them. Don't go that. This I go on, plus when you look now, as little water falls so, the place, everywhere, when you add some place whenever you use the flood, I flood out. Because they drop place where you look. Them they put nowhere where water for run, no water channel or nothing. Now when people come out and talk, whether them are GLP or PMP or no P at all, they come out and talk, people want and say, boop a lie. You must know a Colonel Charles Jr. now come out and tell people them say, boy man, refute everything with them and say, well, because I send package, people them never that talk about package. They must show you the water and you want to say a lie too. This is how them love say a lie and not talk about package and me say, no, you shouldn't send, you should have go. With the team and know how you going at the rain. Because at the same time when the rain fall, you know. See? So we know say we must say no make no sense neither, you know. None whatsoever. See? You understand? Government, only for open arena, looking at some other local place where they can't open. One and two schools when we're closed now and turn it in a field hospital. You have some centers when I use now, whether I center or something. You understand that? Them can turn it in a field hospital more than one. And then it's for them in every parish in Jamaica. The biggest one that be arena because that can more than 500 bed and more can X amount of people in it. See? When you do that, you can't tell me 700 I'm running a paper every minute. Boy, the place over full because people are here. Where the bed them the day in the first place? You say 700. So if we have 10,000, if we have 20,000, that means the whole of the everything stands still. If we have 20,000, I admit everything stands still. Eh? You come like when I joke at you, you know. You don't have 1,000, you have 700 and add. And the 700 and bed done. And you talk about it about to see man I run up and down and make nice. So me I ask you, I say 700 and bed them we have and I say no question over them people and I put people with COVID with people when I have COVID and everybody for use the same bathroom because we not try to mash up everybody. Like when I say yo don't slaughter us who come out. I will not come out. You understand? It will stop. Stop hurt the people them. Look at me a month there, she just talk to get it. Talk to the people them reason the people them and you talk to the people them are more threat. I have a mic in front of me too. And I didn't. And then him drop the word. So you can turn the eagle eye when you drop odd man where you talk about man. I start watching the eagle eye. Because you have Arkai already. We are watching and watching movements. You understand? And don't disrespect the people them. Stop it. Poor people suffer. Poor people suffer the most. Everything want to do a full action. Weekend and none of them poor people because them have no money for eat food much just to keep a show. Them don't see no feed them place and all kind of things are not them. And them have to shut down and bear the whole of this because of food no dirty action. You understand? For please some hoteliers and please on a friend them. Eh? And then some people not blame the government and the government do it. Anything import, export, all kind of things that the government put in a government for run your country. For see to it that everybody alright and thinking no business about the people them. You make a cruise ship when a Barbados them turn it where it come. Or it clean, it not clean. It have much people with the COVID pan it. You understand? But it come. Want to who them mix up and never that show sign and them come off and them go. Them have workers who work to them. The virus now, couple seconds in them way, you will grab it. So them carry it home in for them place too. Eh? Because we not call out the workers, them are work. We not take people for either. You understand? So we come and talk the truth. As I say, we're born, as I say, you know, we have a day, you know. Yeah, man. Yeah, but you see, as I say before, you know. Ross, we say the citizens them put them life at risk. If you there so, the poor people them, you know, say them not eat Ross. You know, because maybe you're a man where you travel Ross, they travel. Don't you live overseas, I say it run down. So, you know, say them people, they might do them little hustling. I know them put them life at risk, and the government put them life at risk. Because them, can you imagine you have 5 youth. Them are around their ass. And you have to look about them, and them not eat. You have some little one, but they run girl left them. Because you have some man, most of the time, them run girl left them. Some people now 4, 3-year-old, 6-year-old, 8-year-old, to look about. And no food at all in your house. And then man come and say, lock them down for 1 hour. The people them put them risk. Who put dream weekend? And the government. Them never have to keep. So you see the outburst, so you see gas station operator dead and some other big people dead. And then run up and down and say, bloop, blop, blop, and I go like the people them. And want blame. When one thing did come true, and the bad a lot down and nothing never did it. Don't Andrew take the glory? He not take the glory, Ross. Ross, tell me the truth. Even if you vote for Andrew and your brother, tell me the truth. Don't tell me to take the glory. And people say, yes, Andrew will have this. So why now, when you open it up and say, boy, we have to live with it. Because that and that and that. And then him deal with it. It a fail. It a fail. And then people have to tell them, say, no, the kind of way. If you, all right, we the us, you're the government. You have 3 million people you deal with. You have to deal with 3 million people. You tell me now. Instead you put some other thing in play. You know, so most of the population, they say the mass of people not working. You know, so them are going on the ark and I think, you know, so enough kids involved and everything. And you know, so you have to them in the you know, say terrible. See? Alright. So hear this now. You do some up and put some things into play. You are really take out a day like Saturday evening, Sunday, Monday, Tuesday, and then by Wednesday. If you bungle up the people like that now, you're not gonna get a bag of people rush out who are gonna try to do something, this or try to do this and that. It's gonna make it worse. When hungry lick you and you never have no medication and you have nothing at all, that's not caring. You ever put things in the business place, them are open, hand sanitizers, masks, this, that. You tell people say do this and that. The longer, the more day you have, it better for you so nobody now rushing pan the bank. Nobody now rushing pan Western Union can't open. But remember, you know, it's coming alright. Let me just prove, because you have some people now get this, you know. Now get this. Let me just prove something to you. So you hear about a hurricane that come. Remember, you know, I hear about a gas shortage. What you see happen? Everybody running pan gas station. Thing you raise. What happen? Chaos, no? Eh? So if the gas, say about the gas shortage and everything, you have your little, you drive it where you have and then you go about your business and one, but a chaos. Hurricane are come and it then near. Run down this everybody the line long so now kind of thing. The same thing because you're locked down every weekend too much days. You have some people now have no water. No, you have some people now have no light now because through the thing run and everything. And them now have no water neither, them not that, it's not like and no food. And you say, maybe lock it down and then you have, but police can go to Kentucky and live them life and everything. Because you come like the massive alone your earth. The poor I said, not the rich man. Females full of food and everything. And when they drive out, nobody not this him. See? You advocate for them. See? You advocate for them. It's bad. You advocate for them. You understand? So no care what we are do, we can't come and say the people them, but yes, we see, you know, we see how the world run and how government deal with them people. They them look about them people and them that run some food and them make sure them alright there. So and you can go out and them lock down some parks and them say alright, boom bam bam. That mean if you are drive and the police are come stop you, them are say a part of lock down or me lock down mall, alright, you want my first day in my yard. And you have the food court, them the food place them open where you buy your food and you stay in your yard. So them have a way of it out, they don't even touch you. But remember everybody in Jamaica, remember it's a third world country, this so-called third world country where them now have nothing them live by hand to mouth, the masses. The big man them are right, you know, but the masses them what talk about. So if you don't want the poor people them move now, you don't have to put nothing on them, but you do so you withdraw the bus them. Let them walk when not even when not too far, because them now you think somebody that walk from out of East Kingston or Spanish Town and they walk come back in our work. Them not have no vehicle neither. That's why they say you can't blame them, you know. Them not have no vehicle, them not have no vehicle, them not have no taxi, them have nothing to move, them can't move. Them are hungry, see me, them are depending on a corner shop. So them easy for control. But you still come in with Jack Coyneism for control them. See? You have this nearly 2 years now. See? But you still never set up no feel real like you come and say, yeah man, I put up me get some bed. Like 10,000 bed. I better me have them and I not use them. More than I want them, but me not have them. The oxygen now so much level as a man, as you as a health minister and boy, talk to IGL. Boy, we not have so much for the hospital because we supply, but if you have a surge, like come see, we can balance 5,000. I say, well, I'll get oxygen in a store. See, like we have the US. I'm gonna say we have a 6 week worth of supply, we can feed the nation. If you can carry in food and import and do 6 weeks, right? Like you have a $3 or $4 billion in a reserve. You don't have the oxygen in a reserve now for say even 2 months can do like 5,000 people then. Even import it and have it. Not even that. So what the plan there for the poor? Which man them alright, you know, because if them want something, them will get it, you know. I don't start me to talk about. See? You have people now lock up. And have nothing to eat. You have forced him to go outside. And then even whether Kentucky, whether them have to have everything when you are going there and you have people look there, make sure your hand, you sanitize your hand, them have masks, them have warm, you have curfew this, you can put in so much thing in play. We don't lock down the days them. So you make running, that means you have to herd immunity. When I say the more get it, we'll reach it somewhere there, you know, so we'll mash them up. We need to stop this foolishness. You understand? Stop it. And we need to put in the bed them. And I tell him press, if them come and say 700 bed, we never have no bed before. Oh, that work. We not have no, and the bed them and see that no one, it's a crisis. It was a crisis long time. People go in there with people go in there with us, all kind of little things, and we look them forget a bed and they get a bed. People, the Jubilee, woman go for a baby, no bed, nothing. They eat up and flu and all kind of things. All about a be a crisis. The health system in a crisis long time. But what they want to do now is just come and just throw it over and say, but it's COVID caused this. Not like that. You understand? People in a Spanish Town hospital. Woman go down with her big son there and him lie down on the bed from shit around from 7 o'clock. He come to the paper too and come to the news. And then in belly I heard him and say, you make me dead. And lie down from 7 at night. And at 9 o'clock in the morning before them call him name, them go throw a sheet on him on the ground. Him dead right there, so. That even a doctor, I'll do him up and I like a triage. We don't say, hey, I can't say him because I'm belly I hurt him and check. Them there right away, you know, say, okay, we have to look about him right away, we have to know what going on, check him up and see if him stabilize up, then him can't wait or so. Nothing. He just lie down there. And I'm pain. Till them not hear no more. And that are like 12, 14 hours in a hospital. And dead same place. When both of them come and say, feed time over, doctor put a little stethoscope on you. Him dead. Lie down there and ball out for the whole time until him dead. Him go silent and dead. And it's not one and two of them it happened to. Woman down in a Kingston, kill the public. KPH, kill the public hospital. KPH, kill public hospital. People, woman down there on bench and them thing and chop and them dead about them never know say she that one made the woman dead. And the first, they lie down for your chest pain and belly pain, them just pass it like can nobody. But this pass to the masses of people who don't have nothing. When you have money now, you can go up one of them hospital there, but make sure you know when you're going there, if them hold you in there and you spend a couple of days, 800 or $1 million. Anything over 500,000. So if you me go and use it, come use an hospital. But up to an hospital, but then everybody can use it. That's the problem. See? Kevin has the money them number one, can you have to pay them some money big, so them not gonna admit you have your own there. And if you touch a button, zoom, and you have a little TV, and you just like you know, it does like in your hotel room, and you press a button and say, the nurse run in and think, can never get them pay. You can talk to them and they talk to the call me doctor there, the doctor all the time. I want to talk to him. And I'm going to talk to you right away. Same doctor work at public and everything, but who could I call him and talk to him? My money make me talk to him. See? So the poor cry for the youth, them I cry for the poor people, man. And government for come out and start deal with people like how you see them government, them prime minister come out and talk and stop drop word. And set up the field hospital them. That them have more beds and things because we shouldn't use them bed them what we have there. So see now so boy bed use up. We never have the bed before. See? Set up field hospital man, even 200 bed in every parish. 200 bed in every parish. Yeah? That should have set up a long time. Oxygen, this, that, set up so you just activate up the thing. Where I get them people here tested. No, keep them in this. Send them over there so. We could deal with them and separate them from who are coming. Little car accident, you know, so we keep our water clean. We can go operate on them, we can go do what we are do. Keep this clean and keep a field hospital over there. So you understand? But you're trying, but that's enough to do. You understand? And then the whole of them place there, from restaurant, bar, the whole of them have hand sanitizers and things and masks. And put in some things in place. Add something in place, man. See? Do the right thing and them close down days that are about no movement days don't go hurt people more. No soon I talk. But there you know, keep them real, you know. Yeah?